Optic nerve head in myopia. A myopic eye or a fundus usually looks a little scary. Due to the elongation of the globe, there is a stretching on the optic nerve head that may lead you to believe that there are certain signs of glaucoma. In all reality, it just makes it very difficult to evaluate a myopic patient that is highly myopic for progressive damage. If you find yourself in that circumstance, the best thing to do is use imaging technology to your advantage. The optic nerve head may look different than healthy eyes, but the nerve fiber layer thickness in a myopic eye is usually very similar to the healthy eyes. And so you can use OCT or other imaging technologies to evaluate the nerve fiber layer thickness, and that's probably the best method to identify if the person is suspicious or not. Let's look at this patient with myopia. You find that the question I ask is, are there signs of glaucoma? Let's go through a few signs. You know that there is cupping, which is one of the signs of glaucoma. You could have a thinner rim tissue, that could be a sign of glaucoma. You find the laminar dots present here, that could be a sign of glaucoma. There is prominent peripapillary atrophy or halo present, could be related. So you have a few things that might say, well, does this patient have glaucoma? Are there any signs for glaucoma? And the answer is, it is tricky because you have a patient that has myopia, and due to the stretching of the globe, that leads to sometimes signs that actually look suspicious of glaucoma, but this patient doesn't have glaucoma. It's just a myope. And so keep in mind that you have to use OCT and other nerve fiber layer analyzers to measure around the optic nerve head, and that gives you a better picture. To summarize, an optic nerve head in myopia is vertically oval in shape. It's also a little bit rotated. Due to the stretching of the globe, it's rotated on its axis. There is thinning in the temporal region that is present of the neural rim. There's also prominent peripapillary halo or peripapillary atrophy that's present due to the stretching of the globe.